I got the flu shot, I think, in February this year.
But 65-year-old Alina Gruder isn't sure she'll do it this fall, isolated with her husband. She worries if she ventures out of her bubble to get a flu shot, she could expose herself to COVID-19.
It's a worry to go to the clinic when the community spread is high.
That kind of thinking, especially among seniors, worries infectious disease specialists.
This is the year to get vaccinated, especially for our high-risk individuals.
Health experts are trying to avoid a twindemic this fall and winter, with a large number of people falling ill as both the flu and COVID-19 circulate in the community. Seniors and people with underlying health conditions are most at risk of complications and hospitalizations from either virus, but unlike COVID-19, there's a vaccine to help prevent the flu. That's why provinces and territories have bumped their flu shot orders up by almost 25%. By this time last year, Canada had purchased 11.2 million doses. This year, we're getting 13.7 million. The Public Health Agency of Canada says it's the largest order of influenza vaccine this country has ever placed.
Heart sounds good.
But that means a lot of pressure on the doctors, nurses, and pharmacists who administer the flu vaccine to meet the high demand while keeping everyone safe from COVID-19.
We can't just have, 50, 60 people an hour coming in to our clinic to get their vaccine, because it's just too many people coming in too quickly with crowds and exposures.
Public health agencies are providing guidance, including spacing people apart, requiring masks, and COVID-19 screenings. We may also start seeing outdoor flu shot clinics and drive-through vaccinations.
I think this will be reassuring.
Once she sees those safety measures in place, Alina Gruder may get her flu shot after all. Nicole Ireland, CBC News, Toronto.
Now, epidemiologist Raywat Deonandan is joining us now because a lot of people have been asking us whether the flu vaccine affects one's chances of getting COVID-19. Is there a link there?
The answer is no, it doesn't affect your chances. There is a study out of Brazil that found that amongst COVID sufferers, those who had the flu vaccine had a lesser bad outcome than those who didn't have the flu vaccine. But in general, the best evidence says there is no relationship, except that the flu vaccine prevents the flu, which means that you're going to be healthy if you get the flu vaccine, and being healthy makes you more resistant to a variety of things, including COVID.
Okay, and so on the thought of this twindemic, I mean, is this flu season expected to be particularly bad?
No, in fact, I think it's the opposite. What we see from the southern hemisphere is that people have been distancing and wearing masks and washing their hands, so we have a less serious flu experience. However, that doesn't mean that the flu won't be here, which means that because it presents with similar symptoms as COVID, it'll cause some confusion and chaos at the clinical level. So we don't want to be monitoring two different curves at the same time. And for those people who get the flu and COVID, there's a special kind of suffering there. So it's important that people get the vaccine to take that one disease, the flu, out of the picture as much as possible.
And when do you figure most Canadians will be able to get the flu shot this year?
The same as we have in the past, mid-September to mid-October, around there. The Americans have it already, so that's good for them, but we'll get it sometime in the fall.
All right. Always good to hear from you. Thank you so much for your time.
Thank you.